Today we're going to talk about lip lift, and they call this a bullhorn procedure because it looks like the horns on a bull, but I like to call it an angel wing procedure because it looks like wings on an angel, but it's a very precise drawing, and this from blue line to the top of the other blue line is how much tissue we will remove, which is usually anywhere from 6 to 10 millimeters, and we're going to shorten the lip by that much, but it's a very intricate design. And here I'm using the Sonoquince radio wave, radio frequency microneedle incising here. And this really cuts down on the bleeding. And because it's a small microneedle, it's easier to wield on mobile tissue than a scalpel. And it's also extremely accurate because it's very, very fine. So we'll frequently use this for our incision because this is a relatively bloody area because the lip has such good blood supply. And we take this up to the lateral part of the nose so we can taper out the lift and lift most of it in the center and taper out to the sides. So here I'm using the Sonoquince radio wave bipolar forceps. Again, really good for controlling bleeding. And here we are removing this segment of skin. And now I'm undermining this with the same type of instrument. So we get a little undermining so we can turn the lip up and get some pout there. And you can also use scissors for this. So we not only want to shorten the lip, but we want to turn it upwards and outwards and have some nice pout. It's really important to line this up precisely. And this is a 4-0 gut suture. We use these as subcutaneous sutures, and these kind of set everything up for the final sutures, and it's important to have these perfectly approximated, and this scar heals very, very nice, although I tell every patient that I will laser it for free if they want, but most people it just heals fine without a problem. So that's our deeper sutures. Then I use 5 or 6-0 gut and put those sutures in, and these will dissolve. And finally, for strength, I use 6-0 nylon because the lip really wants to pull away from the nose. So you have to have strong sutures in here for 1 week. So we take them out at about 7 or 8 days. And then this is the piece of skin that we took out of that particular case, and that's how we do. And now to show you some lip lift before and after pictures. So let's take a look at some before and afters. The left is before, the right is after. You can see how much shorter the lip is. Same patient, how it's shorter and it's turned out and has a little bit more pout. Another patient, really nice result. Look how short that lip is. And when she smiled, she hardly showed any teeth. And after the procedure, she shows normal teeth. When she had her mouth halfway open, you didn't see any teeth, but after you see a normal amount of teeth. Same patient, just a nice result, turned up lip and shorter lip. Same patient, just perfect lip lift right there. This is another patient. You can see how long her upper lip was and after the procedure, how short. You can also see that it turns the lip up and gives more pout in the right side. The left is before, the right is after. You can still see the scar. That's probably about 6 weeks. Another patient, shortening the lip, turning the lip out, and that's what this procedure does. And finally, last patient, and she's about a month out, so you can still see the scar, but it turns her lip out, shortens the lip, and that's what a lip lift does. So I appreciate your time. If you have any questions about lip lifts, facelifts, deep lane facelift, eyelid surgery, facial implants, anything from the top of the head to the collarbone, then reach out to us at lovethatface.com. I'm Dr. Joe Nyamtu. Thanks for the greatest gift of all, and that's your time.